All right, let's dig into how to start practicing joint repair. Emphasis on start. There is no perfect system of movements and exercises, including this one. What I'm presenting here is my best attempt to cover the widest possible range of joint repair conditions based on our body's most fundamental movement patterns. What you build on top of this foundation is entirely up to you. Now, there is a lot of information about to come at you that you need to know in order to do this right. So my recommendation is that you watch this video at least 5 times before you start your joint repair practice, and then come back and watch it once a month for the first year. This will burn the main principles into your brain and give you a much sharper sense about how to conduct your joint repair practice right out of the gate. Ready? Here we go. First, we need to briefly talk about some of the core concepts of biomechanics and exercise physiology underlying joint repair. Don't worry if you didn't go to school for all that. I did. I'm going to translate everything into plain English, but it's very important that you understand at least the broad strokes of why we're moving this way and how it rebuilds your joints before we get started. Okay? So to review from our first video, joint repair is centered on triggering the body's remodeling process. Remodeling is how we break down fascial adhesions and scar tissue that make us stiff and injury prone, repair damaged nerve tissue that causes pain and limits muscle performance, and regenerate deep joint structures like ligaments and cartilage that protect and strengthen the joint itself. We can trigger the remodeling process in 2 ways, actively and passively. Mobility, which is a combination of resistance training and flexibility training, is the most effective way to actively remodel joints, while massage is the most effective passive method. You're going to learn how to do both separately and then pair them together to amplify their effects and heal faster. Let's start with mobility. As just stated, mobility is training for strength and flexibility at the same time. This means putting your joints under a load while stretching the fascia and tendons and bringing the involved muscles to fatigue. This accomplishes several things at once. It breaks down fascial bonding and scar tissue, releases pressure on nerves, creates space within the joint, and then fills it up with synovial fluid. If you remember, synovial fluid brings nutrients to deep joint structures like ligaments and cartilage. Got it? You repair your joints by pulling them apart and filling them up with healing juice. Spoiler alert, this will not be a pleasant experience at first. A big part of the reason people can't heal their pain is because they've learned to avoid it. To train mobility, you have to do the opposite and move directly into your pain so that you can stimulate the damaged tissues to adapt and heal. It should go without saying that there's a right way and a wrong way to do this. The wrong way looks a lot like how you've probably been told to exercise your entire life. Repetitively, with strict form, using a full range of motion. Moving this way is great for building strength in an already healthy individual, but on weakened, damaged joints, it'll just make things worse. It's kind of like trying to rebuild your car's engine when the problem is the road it's driving on. Imagine a road full of potholes. Driving on potholes is not a good idea. Do it for too long and you'll ruin your car. And then you get to take it to the mechanic and spend a fortune having it fixed. The mechanic in this analogy is, of course, an orthopedic surgeon. Mobility, by contrast, is like getting out of the car and filling in the potholes. Understand? So, what does filling in the potholes look like? How do we do mobility right? Here are the rules. Rule number 1, get tense. Before initiating any joint repair movement, engage full body tension. Imagine flicking a switch that turns on all your muscles. Don't engage so hard that you can't move, but enough to feel tension engaged across your entire body. Double down on guts and butts especially. Try it right now as you're sitting there. Squeeze. Relax. Squeeze. Relax. Squeeze. Relax. Squeeze. Relax. Make sure as you're doing this, you're not holding your breath. Nope. Yep, good. You can just relax now. Starting any joint repair movement with full body tension is important for 3 main reasons. It helps activate the weak points in our range of motion that we're looking for. It stabilizes your entire body, helping you move into those weak points safely, and it pumps more blood into our muscles as we move, which is great for everything, but it also helps us push more synovial fluid into the main joint that we're working on. Okay, there's a lot of other reasons why it's good to engage your whole body as you move that we can't get into, but these are the main reasons that we need to have in our mind for joint repair. As a bonus, if you bring a little bit more of this full body tension mentality into your daily living movements, especially butts and guts, you'll find all of them immediately a little bit easier and a little bit less painful. Cool, right? Rule number 2, move slow. This is maybe the most important rule of all. Slowing down our movement allows us to explore our weak points without hurting ourselves. Pain isn't inherently good or bad. It's just a stress signal coming from our nerves. And the entire basis of exercise is that there's always some level of stress that we can adapt to and become stronger from. But too much can push us the other direction, back towards dysfunction or even injury. Moving slowly lets our nerves signal us to the right amount of stress in a progressive, safe manner. Visualize your pain as a scale from 0 to 10 and never go above 3. 3 is when the stress signals coming out of the tissues near our weaknesses and restrictions start to get sharp or uncomfortable. This is often accompanied by involuntary face pinching as our body tries to stop or even reverse the direction of our movement. If you feel this happening, you're already beyond 3, but it's okay. You haven't done anything wrong. All you need to do is simply back up a little bit until that pain signal recedes back down to the 2 or 1 level, aka the sweet spot. Rule number 3, stop and add variation. Our joints are made to move in 3-dimensional patterns, but most exercise programs limit us to 2-dimensional patterns. At best, this makes us strong but uncoordinated. At worst, it leaves our joints vulnerable anytime we move outside the linear patterns. And that's because we're not designed to move in 2D like robots. We are wild, wiggly, multi-planar animals, and our training has to reflect that, or we won't be able to locate and heal our deepest damage, nor will we be able to translate our strength into more coordinated, dynamic movement patterns. For joint repair, this means once we've successfully approached a weakness or a pain point near a 3 out of 10 pain, or we run into any other kind of obvious restriction like tightness, wobbliness, or instability, or just straight up muscle weakness, we want to then pause our movement in that position and then add variation. Adding variation means spending about 5 to 10 seconds exploring a restriction through multiple planes. Play with it, in other words. Visualize every pain point or restriction as a lump of clay, and your job is to work it, pushing it, mashing it, and pulling it apart to get it worn and malleable. This can and will initially amplify the pain or weakness, but as long as you stay below that 3 out of 10 threshold, it will quickly calm down and adapt, meaning it will start allowing you to continue moving through it. Once you feel the pain or restriction begin to diminish, you can return to the neutral form, head deeper into the next level of restriction, and then start all over again. Add variation, start working that clay. Simply repeat this process until you reach muscular fatigue. Which brings us to rule number 4. Rule number 4, don't fatigue past 7. A good joint repair workout is one that tires you, but doesn't leave you so sore the next day that you can't work out again. Remember, we're supposed to do this every day. This means mentally we have to keep track of 2 scales during our movement. As we're navigating our pain levels and trying to always keep them below 3 out of 10, we're also trying to bring our fatigue up to but no higher than 7 out of 10. 7 out of 10 is the point where your muscles are obviously beginning to tire, but you're still pretty far from failure. This is what coaches and trainers are talking about when we say feel the burn. The burning sensation coming from your muscles as they reach fatigue signals that they're filling up with blood, which means the involved joints are filling up with synovial fluid, which is what we want. However, once we hit 7 out of 10, there's not much benefit in pushing much further. You're not bringing in much more synovial fluid. It takes a lot longer to recover between sets, and you risk overstressing the joint and harming it rather than healing it. Plus, as you push deeper and deeper into certain joint positions, you have to always reserve enough strength to get back out of it safely. Nothing is more embarrassing than hurting yourself doing rehabilitation. So don't get yourself into a position where that might happen because you didn't reserve enough strength to complete a smooth exit. So if you're the kind of person who's used to just pushing through pain or training to failure, which that's probably how you got here, isn't it? This will take some getting used to. Check your ego at the door, or at least dial it back enough to accept leaving the party before you're asked to leave. Know what I mean? This is your strength coach telling you to not try too hard. Rule number 5, shake off. Immediately after finishing any movement, take 10 to 15 seconds to shake off the involved joints. This gives our nervous system a quick reset, flushes the lymphatic system of waste acids, and releases crepitus, which are little air bubbles that get trapped in our soft tissues. You might feel or even hear this as little clicks, pops, and cracks in your joints as you shake. Don't be afraid. This isn't hurting you, and in fact is actually helping our soft tissues glide back into their proper, more functional positions, which only adds to your mobility. It's worth mentioning that these same cracks, clicks, and pops are also going to happen during your movements, especially during the early sets. Again, it's nothing to be afraid of. As long as it's just noisy and not painful, it's almost always just crepitus releasing, and it's a good thing. Rule number 6, massage. After shaking off, it's time for massage. Massage is the passive half of joint repair, the yin to mobility's yang. The primary job of massage is to further break down transient fascial adhesions and bonds, or what are commonly called muscle knots, which is not at all technically accurate, but they mean the same thing. Those sore, sensitive points in our soft tissues that make us feel stiff and impede our movement. Releasing these points via massage relieves nerve pressure, lets the fascia transmit force more efficiently, and most importantly above all, restores space to compressed joints. In other words, massage does many of the same things mobility does, but without movement. The drawback, however, is that the effects of massage are very temporary if they're not immediately reinforced by our movement. You can't just massage your way back to joint health. Sorry. But what you can do is pair massage with mobility in the same workout, which is like hitting fast forward on your joint repair once you know how to do it. This is probably something you've never done before, and it's what I believe is the major missing link in how rehabilitation of all kinds is taught in the West. We have a whole section dedicated to massage and how to pair it with your movements coming up later, but for now, just understand from this day forward, you will no longer have rest breaks in between your movements. You're gonna have massage breaks. So, those are the rules of beginning joint repair. These rules will be continually reinforced throughout the program, so don't worry if you didn't catch it all here. However, if you want to do this right immediately, I strongly urge you to go back and rewatch this video several times before starting your practice, and then rewatch it once a month for the first year. This will help you avoid a lot of the mistakes that I made learning all this, which just helps you heal faster. The last thing I want to touch on is how much time you should expect to invest in your joint repair practice each day. If you've been relatively inactive for longer than 6 months, I recommend starting out with just 15 to 30 minutes of daily joint repair practice, focused on just 1 or 2 major joint systems per day for the first several weeks. For those that are currently active, I recommend a minimum of 30 to 45 minutes of daily practice with no upper limit, spread across as many joints as you have time for. There's several ways to accomplish this. You can do your joint repair as a standalone workout, as a warm-up or cool-down before and after more intense activities or forms of training, or, my personal favorite, slipped in throughout the day as a series of short movement breaks in between your regular day-to-day tasks. This last option is especially good for individuals with desk jobs. Take a break every 20 to 30 minutes to perform 3 to 5 minutes of joint repair, and you will start feeling the positive effects accumulate within days. When performing movements, aim for set times of 30 to 90 seconds to reach 7 out of 10 fatigue. Stopwatches are great for learning how to do this. You can hit start, begin your movement, bring yourself up to 7 out of 10 fatigue, hit stop, and then check the time. If it took less than 30 seconds to reach 7 out of 10, back off a bit and do a slightly easier variation of the movement in the next set. If it took longer than 90 seconds to reach 7, increase the difficulty on your next set by engaging your muscles harder, exploring a slightly deeper or more leveraged joint position, or advancing the form from an unassisted to an assisted version. And if you're already in an unassisted version, consider adding weight. And of course, if you need to decrease the intensity, you would just do the opposite of these things. As your practice matures and you get better and better at using full body tension, you'll develop a much more intuitive sense about how to hit this Goldilocks zone of 7 out of 10 fatigue between 30 and 90 seconds without having to use a stopwatch. It may seem like a lot to keep track of now, but trust me, if you're consistent, you'll get there in a few weeks. When pairing movements with massage, aim for a 1-to-1 time ratio. This means if you're moving for 60 seconds, massage for 60 seconds, and so on. This gives you just enough time to drill into 1 or 2 fascial adhesions without cooling down too much and draining the synovial fluid out of the joint. We'll expand on this concept further in the massage module. Got all that? Great job. Now, go back and watch it again. I'm not kidding. Memorize this stuff until you can recite it by heart. So now that you understand the rules of the road, we're almost ready to hand you the keys to starting your joint repair practice. But there's one more topic we need to discuss first, and that's recovery. See you in the next video.